Today we are going to talk about Orchidopexy, or you can say the treatment of undescended testes. Okay, so for undescended testes, as I told you in the last lecture, that in 90 days usually one third of the cases will descend down, and for that we can also provide a hormonal therapy. But according to Bailey 28th edition, it is not recommended because its effect is same as placebo, equals to placebo. Okay, the most commonly used hormonal treatment includes beta hcg, and it's not recommended nowadays. The most recommended treatment for undescended testes is orchidopexy. Okay, this is a surgical correction of undescended testes. It is usually performed between 6 and 18 months of age. Okay, these numbers are taken from Bailey 28th edition, so you can rely on that. For premature, we have to use a corrected age. And what is the corrected age of a premature baby? Consider, for example, consider if a baby is born at 7 month of age, or you can say he has been born prematurely 2 month, and he is now 1 year old. Okay, but the corrected age is not 1 year, as the baby has been born prematurely, like 2 months, so you have to subtract 2 months from it. So now the corrected age will be 10 month. Okay, so whatever the days or months he has been born prematurely, you had to subtract that from the normal age in order to get a correct age. So these this corrected age is used for calculating the time, and this operation usually performed between, as I told you, 6 and 18 month. Okay, testis and spermatic cord, you can say we can divide this whole undescended testis into two things. You can divide it into palpable and non-palpable. Okay, non-palpable testis. And if a testis is present in the inguinal canal, or you can say the high scrotal, which is the most common places, then it will be palpable. You can palpate it by hand, or you can say you can use ultrasound to check it. But if the testis is present inside the abdomen, then it will be non-palpable testis. Okay, because it's inside the abdomen, you cannot palpate it. And the treatment is based on that. If the testis is palpable, what we can do is we can mobilize the testis and spermatic cord and put place in the scrotum. And we usually, what we do is, in the scrotum, we actually make a pouch between the dartus muscle and the skin, and we just place testis in between, just. Okay, but we will place it inside it if the test is usually palpable and at the high scrotal area. And we can do three maneuvers to gain the length of its blood vessels. First is we have to identify the patent process vaginalis, identify it, separate it, and ligate it. Second, we can covering on the spermatic cord. It should be divided, including the spermatic muscles. Third, we can use lateral, because if a testis is present inside the inguinal canal, it does have some lateral adhesions. You have to separate those left adhesions, and then you can push it inside this dartus pouch, or you can say the scrotum. If during orchidopexy you have found out that if the testis is atrophic or suspicious of malignancy, then you have to do orchidopectomy. You do remove the testis. Okay, and the space is extended from as I told you, we just we use a finger to create a space, and this space for that approach is usually taken through the inguinal incision. Incision is given at this point, and then by using a finger we do push and create some space. Now let's come for impalpable testis. Impalpable testis is the laparoscopy is recommended, because we cannot find out the location of testis on ultrasound alone. Ultrasound is most of the time effective, but for impalpable testis, the sensitivity is around 45%, as I told you in my last lecture. Laparoscopic orchidopexy. There are three approaches usually used. The first is the laparoscopic orchidopexy, and in which the triangle pedicle contain testicular vessels, and the vas is just dissected and it is placed inside the scrotum. Then there is, if the blood vessels are enough, and then we just push the testis into the scrotum. If the blood vessels are not enough, then we use a two-stage Fowler Stephens orchidopexy. And these are all the laparoscopic approaches. What we do is, for example, if this is a testis present inside abdominal cavities, these are some pictures, these are some videos which have a very which I have isolated from the internet, and they have a very good demonstration of how to perform the operation. And then I will link them in the videos down description, so you can watch them. And in two stage, what we do is we actually ligate these blood vessels, and after 6 months some collaterals have usually developed, and in the second stage we dissect it out and use these collaterals and place the testis inside the scrotum. This is the second. As I told you, it's very difficult to understand it by just a diagram, so I would recommend you to watch these videos. So, well, let's get back to the lecture, to the Bailey. If no test is found during exploratory laparotomy, okay, then what we do is we look for the deep ring, or you can say the internal ring. If the internal ring is closed and the vessels are going inside it, so you do need to explore the scrotum. Okay, if the vessels are going in and the ring is open, the usually testis is present in the inguinal canal, and some surgeons push it inside the abdomen and then perform surgeries from there, or some other surgeons usually take scrotal inguinal exploration. But the thing you do need to understand is that if you cannot find a testis, you need to find out at least some remnant of a testis. You can find the testicular nubbin or blind-ended vessels. You need to find at least one of them in order to you can say satisfy yourself that we have the testis is absent. Sometimes the testis is absent, and that condition is called vanishing testis. What is this? It is sometimes prenatally the torsion occurs, and the testis started to develop, and before the birth of baby, it gets torsed, or you can say the torsion happens, and the developing testis actually atrophied and just vanishes. And this condition is called vanishing testis, and it happens before the birth of a baby, and at the time of birth you cannot find any testis and the testis is absent. Like, this is the true condition in which the testis is absent. So by this we conclude the topic of undescended testis, and in the next topic we will look at the next topic which is present in the Bailey. And until then, goodbye, Allah Hafiz. This is Dr. Umar signing off.